Is it too soon? Are we opening? And is there a concern here that we might be making an already tough situation potentially tougher? Let's go to Dr. Devi Nampiaparampil, the physician who helps us out with some of these guidelines. You know, doctor, one of the things we see happening in New York is an improvement in hospitalizations. That's something I know when we last chatted, you look at closely. Why is that important to you?
Well, the hospitalizations are a measure of how many people are getting infected and getting sick. I mean, we can't tell just by the test because we don't have enough tests around to tell how many people maybe have mild symptoms and actually have the coronavirus. But the hospitalization rate is more accurate because if people are sick enough to be hospitalized, that means they need oxygen, they need medical care, then that's a more accurate measure of what's going on and how many people are more severely ill. So the fact that that number is coming down in New York, which was the epicenter, is very promising, but the numbers are still relatively high.
Would you feel comfortable telling Americans to go back to work, just in the aggregate?
So I think people have to get back to work because of all of the problems that I've heard of in other respects. I mean, people are having more medical problems. They're not getting treated for that. People who have cancer aren't getting treatment, for example, heart disease. And then people also can't pay for food. They're having trouble in every respect of their lives. I also see problems like with the disparities. So although I think in general, yes, it is safer to be at home, problem is all these disparities are coming out at a time like this. I mean, if I look at it across the board, first of all, we saw in the beginning that people who are older are more likely to develop more severe symptoms and complications from coronavirus, right? Then we heard about issues, African Americans and Hispanics being more likely to have severe complications. And then we saw other things in terms of wealth, fame, for example, the NBA players getting tests when other Americans couldn't who were sick, right? So I think if we continue on this path, the problem is that the disparities will continue. I mean, even more recently, we heard about the Dallas salon owner who's trying to open her business to feed her family, right? So in that case, you know, how are people getting classified as essential workers and other people not being classified that way? So the longer we go on with this shutdown, regardless of what the virus is doing, the more chance that we're going to have more conflict. I mean, even between employers, employees, people who are classified as essential and people who are not. So I think we have to have a plan for reopening and getting people back to work and allowing people to be able to pay for their bills and for their health care and for their other needs. But at the same time, seeing the numbers increasing and knowing that peaks are still coming in some places is very troubling.
You know, Doctor, one thing I didn't understand, you've been very patient, but this notion that's happening in the New York metropolitan area where the cases, the stubbornly high number of just overall cases and deaths is coming from a group doing everything they're supposed to be doing. They're sheltering in place. We don't know the details with each and every member, but they're not doing anything wild or crazy. So does that concern you that some of the mitigation efforts have not resulted in the improving numbers you would think?
Well, I am not as surprised about the stubborn numbers because we never actually stopped the virus. We slowed it down with this shutdown, right? But even when we had essential workers going to work, healthcare workers, for example, right? They still take the subway or they take ride shares or other things. They still come in contact with people. If they had symptoms, they still tried to work to save lives in some cases. We saw the CDC relax some of the guidelines. So if you have sick people who are in contact with other people, I mean, they still spread the virus. It's just that we limited the number of people that they would have exposure to. Same thing if you think about supermarkets, pharmacy chains, etc. The number of sick people is much less, and the number of contacts that they have are lower, but it still happens. I mean, that's why we were seeing also the subway workers getting ill. So I think that's part of the problem in New York City, where you have so many people and it's so densely populated and you needed people to go to work still. But I think that in other areas that are more rural, maybe this will be, it won't be as stubborn. But on the other hand, I hear about other challenges as well. So for example, if I talk to some of my doctors in other areas, with telehealth, for example, which is the idea that patients can get their care by phone or by internet, in some areas, patients, they don't have money to pay for their cell phone bills, much less the internet, if they don't have money for food. So then you had people who would go to their doctor's office, kind of wait in the parking lot, hoping that someone would see them. So in those scenarios, the doctors don't have PPE, neither do the nurses, because all the PPE is being diverted to the hospitals, right? But then they would see the patients to try to help them, basically hand them their own cell phones.
All right. Doctor, I'm sorry to interrupt you. Kelly McEnany, the White House press secretary, now addressing the press.
Indeed, in world history. 75 years ago today, our brave American forces defeated fascism in Europe.